everyone. My name is Dr. Philippe Hamida-Pisal. I'm a French aesthetic and wellness doctor based in central London, Harley Street. And I'm the current president of the Society of Mesotherapy of the United Kingdom and the co-director of the Society of Mesotherapy of South Africa. Our clinic is focused on aesthetic treatment, wellness treatment, dermatology clinic, and also clinical trials. So our biggest issue we have in the practice is not really an issue. It's more about, competition. There is a lot of competition in this street, which is famous for centuries about, all the clinic, but also patient retention, because patients, they want to get a result. They want to have a quick result. They always want to the latest, innovation, and also they're more prone for non-invasive treatment right now. So this is a very good, very interesting, because I discovered LPG machine and LPG technique when LPG was in UK, and I was very interested because I knew LPG before from France, obviously, because LPG is very big, and I wasn't 100% convinced about the result, and because I'm working with quite a few model agencies, and one of the models, she went for the haute couture in Paris, and she's been told that she was too fat. So believe it or not. So when I went to LPG center in London, so the trainer mentioned to me that she could do something in 3 sessions, which I found it a bit strange. And in fact, within 3 sessions that she offered for me to show the benefits of the machine, the models, when she went back to Paris for the refit for the haute couture, everybody mentioned to her, but have you lost weight? Well, in fact, she didn't lose weight. The purpose was to reshape, and she did manage to do the haute couture. So it's how I found LPG, the technique, and how to get amazing results. I started using LPG technique more than, if my memory is good, more than 12 or 15 years, I think, right now. It's when I first had my first LPG machine. So before the Alliance, I used to have the Cellular M6 Integral, which I was very pleased with it because I had a very good result. And what made me decide to go towards the latest generation is because latest generation is always, new treatment option, new option available for our patient. But the most important, they have as well these tablets. And these tablets is very important because, in fact, when we take our patient record, we take pictures as well. And the tablets, we're able to show to the patients the before and after, and all based on the same, record, on the same information that we had previously. So we don't have to re-enter all the details. Everything is already pre-recorded on the tablet. So when we use the endermologie treatment, it's very important to know what we want, to never promise what we can't do. So do I use endermologie on its own or combine? It's all based on a request of the patient. I like to use personally combine, but also I can do just by itself as a facial treatment or just a massage or cellulite. But personally, I like to do combined treatment because we know that, in aesthetic, In mathematics, 1 plus 1 is 2, but in aesthetic, 1 plus 1 is 3, 4, 5. So combining LPG endermologie with another aesthetic treatment, we can see a much better results. So what are the most important treatments which are combined with LPG machine? So it's, first of all, obviously, mesotherapy. I love combining LPG and mesotherapy because I've got much better result after just one session. I like to combine as well LPG mechanostimulation with filler because it's enabled to recover quicker for the patient, especially at the entry point, and we've got a better response from the skin. What else? I like to do as well LPG with peeling, because it's where we have a better response from the skin, less redness afterwards. There is so many treatment options that we can do combining with LPG mechanostimulation and better recovery afterwards. The added value for the combined treatments, post and pre and post procedures, is patient satisfaction, first of all. Outcome, we've got a better outcome than if we do the aesthetic by itself. We've got better patient retention. This is very important because we're able to offer the same treatment with better results. So patients, they're going to stay with us for a longer time. And cost is really cost effective. So how many sessions do we recommend before, pre or post procedures? It depends the procedures. It depends the ability of the patient. It depends, the finance of the patient. So really, pre-procedures, I recommend 1 or 2 treatments to prepare the skin, okay? Post-injection, there is no really limitations. So I like to recommend 3, 4 sessions because it's where we have the enhancement of the aesthetic treatment we've done previously. So it's really based on availability of the patient and the finance of the patient, but there is no limitation. So 2 days, on average per day, we do between 2 to 3 sessions per day. And thanks to Natasha, my colleague, who is been fully trained, we're planning to increase much more. Our aim is to increase to 50% of our patients to have endermologie prior treatment and post-treatment. So regarding the treatment request, the percentage, okay, so it's face and body. More face than body. For the body, the most requested treatment is cellulite, combining, so LPG on its own or LPG combining with mesotherapy for cellulite. LPG for body reshaping. LPG for bum lift. We have more and more patients asking for bum lift, especially coming, when will come the summer. For the face, we have more and more patients who request non-injectable. So our patient population, it's 70%, 70, 30%, 70 female, 30% male patient, age group 30 onwards over, obviously. And they all request roughly the same, apart from the male patients. They don't request, cellulite, because men, they don't really have cellulite. So, but they all request, facial, male and female patients. Men, they request as well, LPG mechanostimulation for, tired muscles, recovery after sport injuries. So this is the profile of a patient we're targeting. The LPG, so bringing the LPG machine in our clinic make us think outside the box. So what does it mean really? It's we do a fully holistic approach on our patients. So we're not just injecting, we do a full, assessment of the patient, and it brings us, patient satisfaction, because they can see that we're not just offering aesthetic, but we are also concerned by their wellness. So LPG bring us patient satisfaction, and obviously patient satisfied tells their friend that they're satisfied, and bring also other treatments which are non-injectable, that easy to talk to. So the message I would give to my colleagues who think, who heard about LPG machine, is to think properly, because there is a lot of clinic around us. So what will make a difference is not, an extra treatment, but it will be more, a holistic approach towards our patients. So, it's 360 degrees when we do a treatment, and targeting a specific request from a patient with specific treatment from LPG machine, patient satisfaction, long-lasting results. So instead of a filler lasting 4 months, it will last an extra 2 months. And returning patient, they're going to tell their friends. So it's really more about, not just, it will be not just aesthetic clinic, but it's going to be a holistic aesthetic and wellness clinic.